This month went by so fast. I can't believe it's been almost 1 month since my last update video. And look, I'm jogging. It's a miracle. My knee actually hurts a bit today. So a little update. My physio did clear me to start doing squat jumps and going a little higher. And I was feeling really strong earlier this week, but then I really pushed myself to try to jump higher. And that did not feel good. I know it didn't feel good because the next few days, my knee hurt. So that's a sign that I need to take a step back and rest a bit longer before working towards it. Everything else that my physio has prescribed or told me to do has been good so far. I'm starting to do intervals of jogging for about 2 minutes, and then I'll do a walking break for another minute, and then a few rounds of those. So the light jogging has been fine, and the pogo jumps have been fine. But ever since my squat jump, my knee has been not feeling as great and a bit more stiff in the morning and throughout the day. I'm hoping that it gets better soon. And another thing I got this month was some slant boards, and I love them. It really helps me to put more emphasis on my quads and feel my quad activation more when I do squats and single leg things with the slant boards. I think this is actually going to be really helpful in my recovery. I'm obviously going to do squats and other things without it, but once in a while, I feel like it really activates my quad better and gives me the ability to go deeper into my squats. Put some sunglasses on because it is sunny today. Anyways, what I was saying was slant boards. The slant board has been really helpful. And then I've started to incorporate some of the balance board into my routine, which has been fun. And balance boards are really hard. Even my partner, who doesn't have an injury, was finding the balance board pretty hard. Can you hear the birds? It's actually really nice here. Another thing I've been trying to navigate is how to share my injury with other people, because I can't really expect people to know what it is because I didn't really know much about it beforehand either. And I know people are going with good intentions and not everyone knows how to respond to news like this. But when people say things like, oh, at least you can walk now, at least, it doesn't really make me feel heard. It's like, well, your injury could be worse. That's not really helpful. So there's that, but I don't blame them. It's just, this is how my response is when I hear that. It's like, yeah, I guess so. And then another thing that I'm starting to notice is that invisible disability that people don't really talk about, because I'm starting to look normal in most of the things I do. Even things like sitting down or standing up and standing in an area for too long. I never really thought about it before, but it could be really hard for someone who, is experiencing pain because of my injury. I have a stronger level of compassion for anyone else that's experiencing any sort of disability that makes it harder for them to stand for too long. I've been sleeping pretty well, which I think has really helped with my recovery. So far, if you don't know, I've started to do PRP treatments. My first treatment did not go very well. I feel like I didn't have the right person with the right experience. My second PRP went really well. After swelling for 4 days, I felt amazing. And from being able to walk only about 4 kilometers, I was able to walk 10 kilometers without pain and fatigue, my knee felt amazing. And so I think I am going to go for 1 or 2 more treatments. They are really expensive, so I don't know if I would recommend it, but I'm at this point where I'm just trying it all. And the person I'm seeing now has so much more experience, and I feel more comfortable with them doing the treatments and the methods that they use and the machinery. Practitioner can make a huge difference, because I can totally see PRP being something that practitioners take advantage of because it is so expensive and they don't spend that much time. So it can be a money grabber for sure. The concept of it is insane. Like, they're extracting your blood. They're literally extracting your blood and putting certain components back into yourself. So you're paying a significant amount of money for your own supply of growth factors and plasma and platelets. That's actually crazy. Anyways, the second treatment has been really, really helpful. So I do want to do more, even though there's really not much evidence in this all. So I can't really say if it's my training or the injections that are helping, but I'd like to think that in combination of everything I've done, is helping with my healing. So that risk is totally up to me and my own decision. Wow, look how beautiful this is. I saw my surgeon for the second time after about 3 months since my injury. And he said he'll see me again in 2 months and see where I'm at. And it kind of sounds like from our conversation that depending on what kind of sports I want to go back to, how far I can go with the rehab, it's hard to say. For some reason, he told me that, it's about 50-50 to go back to sport without surgery. And if all goes well with surgery, there's like an 80 to 85% that the person will be satisfied with the outcome of their surgery. So if there's a 50-50% chance that I can get back to the things I want to do without surgery, I'm going to try that first. Because at this point, I really don't want to do a year of rehab again and start back to learning how to walk. But I guess we'll see. I've walked about 2.5 kilometers now and I'm feeling better than I did when I started. So I think warming up is helping to make me feel less stiff. I do feel like I'm kind of neglecting my walk back, my upper body. So I think I want to start incorporating more balance with all of my body parts instead of just my knee. I realize that sometimes it's much harder for us to see progress in ourselves. And that's why it's helpful for me to have a physiotherapist, because when I see them again, I'm like, wow, yeah, I remember that session. I have progressed a lot since then. On a daily basis, I might not always feel progress. And sometimes there are setbacks. Like I mentioned this week, how I did the high squat jump and my knee has been not feeling great since then. But those physio sessions every 2 weeks that I'm having right now is really helpful to remind me of like, oh yeah, I remember where I was that session. So every week and every month is not always going to be a good month, but it's those little steps forward. I honestly don't know what else to say. Last month and this month has just flown by. I mean, I do feel like my legs have been getting stronger. I have been increasing my weights for all the exercises, like single leg presses, slowly getting stronger, but a month is not that long in the grand scheme of things. So let's just keep going and I will check in with you next month. Bye.